Erna Solberg, Prime Minister of the Kingdom of Norway. The floor is Your Excellency.
Chair, achieving the SDG 3 on health is vital to achieving many of the other SDGs. This is because ensuring healthy lives is essential for sustainable development. In recent years, about 70% of all deaths on our planet have been due to non-communicable diseases, NCDs. In both developed and in developing countries, NCDs are a major challenge. NCDs affects us all, rich and poor alike. We all have to work together to bring down the number of premature and preventable deaths caused by these diseases. A key target under SDG 3 is target 3.4 on NCDs. Under this target, we have committed to reducing premature mortality from NCDs by 1/3. We are not on track. At the current pace, we will not reach this target. We must challenge the common misconception that there is little that can be done to combat the NCDs. In fact, powerful tools for fighting NCDs do exist. The World Health Organization has identified the evidence-based interventions that are most effective for turning the tide. WHO recommends increased taxes on tobacco, alcohol, and products of high sugar as cost-effective measures for combating NCDs. These are not always popular measures, I can underline to that, but they are necessary ones. Countries should take bold steps both in financing and in implementing national NCDs responses. The most efficient and cost-effective approach to fighting NCD is prevention. However, other measures are also necessary. We should offer treatment to those who are living with the disease. Norway supports WHO as efforts to put universal health coverage at the top of the public health agenda. We believe that ensuring health care for all is crucial for addressing NCDs and other global health challenges effectively. We also need to engage the private sector and the civil sector in our effort to fight NCDs. We must put in hard work needed for if we are to achieve the SDGs by 2030. We tend to focus primarily on the major goals, such as eradication of poverty, but we must also put in the hard work needed to reach the important targets that we have set, such as target 3.4 on reducing non-communicable diseases. Thank you.
I thank Her Excellency Erna Solberg, Prime Minister of the Kingdom of Norway, for her statements. I now give the floor to His Excellency Daško Marković, Prime Minister of Montenegro. The floor is yours, Excellency.
Uvaženi predsjedavajući, Vaše ekscelencije, želio bih da vas pozdravim i izrazim zadovoljstvo učešćem na 3. sastanku Generalne skupštine posvećenom prevenciji i kontroli nezaraznih bolesti. Svjedoci smo da hronične nezarazne bolesti danas globalno izazivaju blizu 80% smrtnosti stanovništva i da taj trend raste, što utiče ne samo na zdravlje populacije, već i na održivi razvoj i na radnu sposobnost ljudi u najproduktivnijem periodu života. Narastajuća epidemija hroničnih nezaraznih bolesti sve više opterećuje zemlje niskog i srednjeg nivoa razvoja, najsiromašnije i najranjivije segmente svjetske populacije. Dame i gospodo, u mojoj zemlji Crnoj Gori hronične nezarazne bolesti su prepoznate kao ozbiljan javnozdravstveni problem, a statistički podaci pokazuju da se najviše obolijeva od kardiovaskularnih bolesti, kancera, dijabetisa i respiratornih oboljenja. Prijevremeni mortalitet od ovih bolesti oboljevanje i povezani invaliditet predstavljaju ozbiljne generatore rasta zdravstvene potrošnje u zemlji. Zbog svega navedenog, ulaganje u prevenciju i multisektorska saradnja predstavljaju paradigmu unapređenja zdravlja populacije. Vlada Crne Gore je u potpunosti posvećena rešavanju ovog problema, pa je usvojen i niz strateških dokumenata koji tretiraju u oblast između ostalih i strategiju održivog razvoja, strategiju za prevenciju i kontrolu hroničnih nezaraznih bolesti i strategiju za kontrolu štetne upotrebe alkohola. Uzimajući u obzir činjenicu da epidemiju hroničnih nezaraznih bolesti determinišu faktori koji su van dometa i kompetencija zdravstvenog sektora, Vlada je osnovala Nacionalni savez za koordinaciju i prevenciju hroničnih nezaraznih bolesti u Crnoj Gori, koji lično presjedavam. U sastavu savjeta su ključni rukovodioci sektora za ekonomsku politiku, finansijski sistem, održivi razvoj, turizam, ekonomiju, prosvjetu, rad i socijalno staranje. Smatrajući neophodnim regionalne inicijative na nivou predsjednika vlade, ministra financija i zdravlja, predložio sam da u okviru berlinskog procesa najavim inicijativu Crne Gore i iniciramo konsultacije o harmonizaciji akcioznih politika kao instrumenta unapređenja zdravlja i promovisanja održive ekonomije u saradnju sa Svjetskom zdravstvenom organizacijom. Sve navedeno je u cilju sagledavanja mogućnosti usklađivanja akcizne politike u regionu kao efikasnog instrumenta kontrole rizikofaktora za nastavak hroničnih oboljenja. Ovim institucionalnim mehanizmom smo potvrdili i potvrđujemo odlučnost da pružimo efikasan odgovor na epidemiju od hroničnih nezaraznih bolesti. Hvala vam na pažnji.
I thank His Excellency Dasko Markovic, Prime Minister of Montenegro, for his statements. I give the floor now to Her Excellency Maya Mottley, Prime Minister of Barbados. The floor is yours, Excellency.
Thank you very much, Mr. President. Barbados welcomes the convening of this high-level meeting to address the issue of the prevention and control of chronic non-communicable diseases which steal the livelihood, limbs, and lives of our Caribbean people, and often striking them down in their most productive years. For us, diabetes, heart condition, strokes, these are the things that cause too many of our people either to die or to have an impairment on the quality of their lives. And indeed, the impact on our social security systems and our healthcare budgets is incalculable. I salute the work of CARICOM countries in having NCDs placed on the international agenda and commend the United Nations member states for seeking to craft a response commensurate with the gravity and the breadth of the threat of NCDs. We will continue to implement our national and regional NCD commitments. In this regard, our efforts have been bolstered by the technical support of several UN agencies, including the UN Agency Task Force and PAHO and WHO. Approximately 2/3 of Barbados' healthcare budget goes into treating NCDs, with 25% of our adult population affected by one or more of the chronic NCDs. This is not just a serious problem, it is an urgent one. Consequently, when my government took office in May of this year, we understood that our traditional investment in our people could be severely compromised if we did not win this battle. We have therefore added a new and innovative approach to shift the emphasis from our healthcare system being focused on treatment to that of prevention and promotion of wellness. And we are now considering the implementation of health as wellness grants to those who change their lifestyle, exercise, and improve their diets. We look forward to working with members of the United Nations because we recognize that front-of-label packaging will make no difference unless countries of the world come together to influence the producers of the products, because many of our countries are simply too small to be able to change packaging on our own. If we want to win this battle as we have done with other diseases in our history, then the time for collective action is now. Thank you.
I thank Her Excellency Amor Mottley, Prime Minister of Barbados, for her statements. I give the floor now to His Excellency Twailiya Pasail Lilima Li Yanagwi, Prime Minister of and the Minister of Foreign Affairs of the Independent State of Samoa. The floor is yours, please, Excellency.
President, if in every 2 seconds someone aged 30 to 70 years dies prematurely from non-communicable diseases, then we are looking at around 90 premature deaths due to NCDs by the end of my 3-minute statement. NCDs is responsible for 71% of all deaths worldwide. This is unacceptable. This stark reality demands a scaled-up response for prevention and control. SDG target 3.4 to reduce by 1/3 premature mortality from NCDs by 2030 is a critical step in ensuring universal action against NCDs. The interlinked and integrated nature of the SDGs further emphasizes the need for a multi-sectoral and multi-stakeholder approach to combating NCDs. Unfortunately, the current level of global commitment and investment is inadequate if we are to meet SDG target 3.4. Economically, NCDs continue to impact on already overstretched government health budgets and the economy in general. The projected costs for developing countries by 2030 are a staggering $7 trillion. Strategic solutions to help finance and support the fight against this epidemic must be found. Addressing NCDs is an urgent priority for small island states as reflected in the Samoa pathway. Sustainable development can only be achieved in the absence of a high prevalence of debilitating communicable and non-communicable diseases. In response to the call for urgent action, Pacific Islands Forum leaders have invested political capital by explicitly declaring the Pacific is in an NCD crisis. Our region has some of the highest rates of NCDs and associated risk factors globally. Clear emphasis is on addressing NCDs through a multi-sectoral NCDs partnership guided by a Pacific NCD roadmap towards minimizing the NCD risk factors. A Pacific NCD summit was held to address the crisis and involved, besides health, the ministers of finance, economic and trade to achieve a healthy islands vision for the Pacific. At the national level, NCDs account for almost half of the deaths in Samoa. We have one of the highest obesity rates, particularly amongst children. Current data, however, is showing a decrease in the prevalence of alcohol drinkers and smokers and an increase in the prevalence of people who are physically active. Samoa has integrated its commitments to addressing NCDs into the implementation of its Sustainable Development Strategy and health sector plans. The Multi-Sector National NCD Policy and Plan of Action 2018 to 2023 are being finalized. Priority is given to universal access to primary health care and public health services through upgraded and strengthened rural health infrastructure and better service delivery. We have localized the WHO package of essential NCD or PAN interventions model into a primary healthcare model that captures the Samoan culture and way of life. Hence, PAN Samoa is a village-based model for prevention and control that emphasizes community participation, ownership and leadership, and clarified roles for all the village social institutions, such as women committees. Urban-based NCD clinics serve the urban population diagnosed with diabetes and hypertension. We remain committed to ongoing public health awareness programs and promoting strategic partnerships with communities, schools, private sector, sports bodies, and NGOs to enhance awareness on the threat of NCDs. We have in place policies and legislations that strengthen tobacco control, address harmful use of alcohol, and reduce consumption of food and drink products directly linked to NCDs, especially salt and sugary drinks. Government has introduced an excise tax of 8% on a range of such products, with the further tax increases to tobacco and alcohol added this year. We are awaiting a World Bank NCD taxation study to generate policy-relevant findings on the implementation of taxation measures and effects on consumer behaviors, pricing, and government revenues. Samoa remains committed to the global fight against NCDs through scaled-up capacity building of all stakeholders, quality-assured data collection, and statistics for informed and forward-looking policy decisions, as well as strategic partnerships to mobilize resources and support. I thank you, Chairman, President, for your attention.
His Excellency Taulipa